Today I'm going to talk about a very important and controversial question. What is cancer, and how does it develop? And is Putin's cancer vaccine a propaganda or a real breakthrough? If you want to find out, stay tuned and don't forget to like, share, and subscribe. Cancer is a disease that occurs when some of the body's cells become abnormal and grow out of control. Normally, cells grow and divide in an orderly and regulated way to form new cells as the body needs them. When cells grow old or become damaged, they die, and new cells take their place. However, sometimes this process goes wrong, and abnormal or damaged cells grow and multiply when they shouldn't. These cells may form lumps of tissue called tumors, which can invade nearby tissues and spread to other parts of the body. This is called metastasis, and it is the main cause of death from cancer. Cancer can start almost anywhere in the human body, which is made up of trillions of cells. There are more than 200 different types of cancer, each with its own characteristics, causes, symptoms, and treatments. Some of the most common types of cancer are lung, breast, colorectal, prostate, skin, and stomach cancer. But how do cells become cancerous in the first place? Well, the answer lies in the genes. Genes are the instructions that tell the cell how to behave. They are made of DNA, which is a long molecule that contains the code for making proteins and other molecules that control the cell. Genes are located inside the nucleus of the cell, and they are organized into structures called chromosomes. Sometimes a change happens in the genes when a cell divides. This is called a mutation, and it means that a gene has been damaged, lost, or copied too many times. Mutations can happen by chance, or they can be caused by external factors, such as radiation, chemicals, viruses, or smoking. Some mutations are harmless, or even beneficial, but others can make the cell grow and divide faster, ignore signals that tell it to stop or die, evade the immune system, or attract blood vessels to feed the tumor. These are called oncogenes, and they can turn a normal cell into a cancer cell. However, not all mutations lead to cancer. In fact, most of the time, the cell has mechanisms to repair the damage, or to destroy itself if it is beyond repair. This is called apoptosis, or programmed cell death. The cell also has genes that act as brakes, or tumor suppressors, that prevent it from becoming cancerous. One of the most famous tumor suppressor genes is called p53, and it is involved in many types of cancer. When p53 is mutated, the cell loses its ability to control its growth and division, and it becomes more prone to accumulate more mutations and become malignant. So, to summarize, cancer is a disease that happens when some cells become abnormal and grow out of control, forming tumors that can invade and spread to other parts of the body. Cancer is caused by mutations in the genes that regulate the cell cycle, which can be inherited or acquired. There are many types of cancer, and each one has its own features and treatments. But wait, there's more. You may have heard recently that Russia's president, Vladimir Putin, has claimed that his country is close to creating vaccines for cancer that he called drugs of a new generation. Is this true, or is it just a propaganda stunt? Well, the truth is, we don't know for sure. Putin did not give any details about what kind of cancer vaccines he was talking about or how they would work. He also did not provide any evidence or data to support his claim. So we have to take his words with a grain of salt, especially considering that Russia has a history of making exaggerated or false claims about its scientific achievements, such as the Sputnik V vaccine for COVID-19, which was announced before completing the necessary trials and tests. However, that does not mean that cancer vaccines are impossible or non-existent. In fact, there are already some vaccines that can prevent certain types of cancer, such as the HPV vaccine, which protects against cervical, anal, and oral cancers, or the hepatitis B vaccine, which protects against liver cancer. These vaccines work by stimulating the immune system to recognize and eliminate the viruses that cause these cancers. There are also other types of cancer vaccines that are being developed or tested that aim to treat existing cancers rather than prevent them. These vaccines work by teaching the immune system to recognize and attack the cancer cells based on their specific characteristics, such as antigens, which are molecules that are unique to the cancer cells. Some of these vaccines are personalized, meaning that they are tailored to each patient's individual tumor. For example, BioNTech, the German company that partnered with Pfizer to create the COVID-19 vaccine, is also working on a personalized cancer vaccine that uses mRNA technology to deliver the instructions for making the antigens to the immune cells. Another example of a cancer vaccine that is being developed is by Moderna and Merck, two American companies that are also involved in the COVID-19 vaccine race. They are working on a vaccine that targets melanoma, the most deadly type of skin cancer. Their vaccine has shown promising results in a clinical trial, where it reduced the risk of recurrence or death by 50% after 3 years of treatment. So, as you can see, cancer vaccines are not a fantasy, but a reality. However, they are not a magic bullet either. They are still in the early stages of development and testing, and they face many challenges and limitations such as safety, efficacy, cost, and accessibility. They are also not a one-size-fits-all solution, as different cancers require different approaches and strategies. They are, however, a very promising and exciting field of research that could potentially revolutionize the way we treat and cure cancer in the future. And that's it for today's video. I hope you learned something new and interesting about cancer and cancer vaccines. If you did, please give this video a thumbs up and leave a comment below with your thoughts and questions. And don't forget to subscribe to my channel and hit the bell icon to get notified when I upload new videos. Thank you for watching, and see you next time.